Well, good evening, everybody, and thank you for joining us tonight. This is the Health Pathways information session for allied health professionals. My name is Sandy Vincent from the PHN Education team, and I'm joined tonight by Erica Drew, who is the manager of the Central Coast Health Pathways, and Evan Morris, who is the program officer for Hunter New England Health Pathways. Before we begin, I would like to acknowledge the traditional custodians of the land that I live and work on. Today, I'm in Darkinjung land, and pay my respects to their continuing culture and contributions to the life of this region. A few things to let you know before we get started. This session is being recorded and will be available for you to view in our education library, along with a copy of the slides in a few days' time. As an attendee, your cameras and microphones are automatically disabled. If you do have questions, please send those through via the questions box. You'll see that in the control panel, and at the end of the session, we'll go through those questions with our presenters. An evaluation will come to you directly after the session. Please do complete that. Your feedback is extremely important to us. It helps us to plan and to improve on any future education sessions. It's now my great pleasure to hand over to Erica and Evan, who will be presenting for us tonight. All right. Great, folks. Erica, you should be able to, you still have control, so you should be able to show your slides.
Okay, great.
That's it. Your slides have come up.
Great. Well, thank you very much, Sandy, for that lovely introduction, and welcome everybody tonight to our Health Pathways overview for allied health professionals. And Evan and I will be sharing the discussion tonight, so we'll be sharing back and forth between who's presenting which sections, and I'll just commence the slides now. Okay, so first up we've got the URLs for both Central Coast Health Pathways websites and the Hunter New England Health Pathways website, and the login details there for you to access those. So the Health Pathways websites are for health professionals only, so they're password protected. And then we've got the patient info sites for both regions as well there, and those are open access for patients and the general community. So no password required for those. All right, so we'll just give you an overview of what Health Pathways is. Sorry, I just need to reorganize my screen. Okay, so Health Pathways is both a process and also a product at the end, which is the website that is published and available for local health professionals. So Health Pathways is a systematic way to improve the care between primary, secondary and tertiary care. It provides an online decision support tool, which is the website, which is for clinicians to use, primarily targeted towards general practice teams during patient consultations. It provides locally agreed information on how to assess and manage conditions and how to refer patients to local services. So there's a lot of referral information in both the websites, and it provides agreement on and clarity on access to services, who provides which services and where and when they're provided. So we work with subject matter experts at the local health districts and get agreement on services, information on the criteria, which patients are eligible, and then that all gets articulated onto the websites. Also, Health Pathways is a large community. So it was originally set up in New Zealand in Canterbury District by the Canterbury District Health Board, and then it's spread throughout Australia and now in New Zealand, and now the UK is also taking it up. All right. Additionally, Health Pathways is a whole of system approach. So we take the view that each region's health system is one health system, and we're trying to break down silos or I guess barriers between primary care and secondary care and tertiary care. So in our region, Health Pathways is a partnership between the PHN and the Central Coast Local Health District and the PHN and Hunter New England Local Health District. As I said before, it was originally developed in New Zealand, and it's a highly successful model of collaboration that has spread outside of New Zealand. We've got 33 active regions in Australia, 11 in New Zealand and 5 in the UK, with more being added in the UK as time progresses. And it's been around a long time in our region. So Hunter New England, the website went live in 2012, and Hunter New England was the first region in Australia to take it up, and then 2013 on the Central Coast. And ultimately, this is what we're aiming for. So at the moment, we do have quite a fragmented health system, and we do have some separation in the sectors, and part of that is driven by the funding systems, you know, the state-based funding versus the federal Medicare-based funding. But what we're trying to do is aim towards this, where we've got one health system and the patient is able to navigate through the system with the help of their GP, and they don't see any of that fragmentation or any of those barriers. Okay, I'll hand over to Evan now for the next section.
Wonderful, thanks Erica. I can see that we've just got a few new people joining us. So we're just providing a bit of a background context to Health Pathways. You haven't missed too much. We're about 5 slides in. So I just wanted to briefly touch on some of the key points about what Health Pathways is, and I guess how you can access it, and what it looks like, and how we develop pathways. So first and foremost, from an accessibility perspective, it's actually a website. Primarily, you don't need to install anything. It's just a website that you access. We have that some light security on it, and we'll be sharing the slides at the end as well, so you'll have those login details. So it can be run from any computer in your workplace, and as I said, you don't need to install anything. Easily updated from our perspective. So we've had Health Pathways in the Newcastle region for 13 years. Out where I'm based in the New England Northwest, we've sort of been live and localizing content from about 2015. And what it means is our ability to rapidly update information. So we have clinical pathways that you're going to have a look at tonight, and then we also have referral information. So from a Hunter New England perspective, we're actually in the process of migrating to a new directory format that actually enables us to make changes overnight to service information, and that's something that Central Coast has had in place for a little while now, and those update timeframes vary, but we are getting better at doing that. We are a relatively small team, but it means that we can update information a lot more efficiently and faster, which is fantastic. And from a dynamic perspective, we're constantly updating the Health Pathways platforms with new content. COVID was a particularly good example of that, where we rapidly deployed COVID-related pathways, and they very quickly became the most frequently visited content on the site. Not only in our region, but we were a lead region, and they were picked up by many of the other communities right around Australia. And again, they were very popular pages. And the ability to search for that information via the online search functionality that we will have a look at tonight enables you to quickly find the information that you're after, whether it relates to a particular pathway, whether it relates to your particular service, and then the ability to potentially send feedback on that service is also very important. So if you could go to the next slide, please, Erica. So I won't bore you with the details, but just to give you some context of what sits behind Health Pathways. So these are the teams that exist. Now, myself and Erica are in the team where it says Health Pathways Program Team, so that's the second from the right. And our role is to facilitate and coordinate all of everything else that you see on the screen with regards to the clinical lead, clinical editors, subject matter experts, and reviews. I'll briefly step through each of those because it's important to know how these pathways, resource pages and referral pages are being developed, to give you the confidence, I guess, to know that, why is this being done, how is it being done, and how is it being utilised. So clinical lead, that's usually an assigned general practitioner that helps coordinate and look at the pathways and develop some strategies for the team moving forward. They might be identifying pathways that need to be developed and helping develop and write those. The clinical editors, so in the Hunter New England region, for example, we might have a team of 10 community, be it GPs, pharmacists, nurses, that sit within, and all of those or most of those are out in community, so they're actually in general practice, for example, or in clinical settings, and they come in and help us review and develop the clinical pathways and work with the subject matter experts. So it might be a pediatrician, it might be a physiotherapist. When we write the pathways, we localize the content and we bring everybody into a room together that relates to, so if it's behavioural concerns in children, there might be a paediatrician there might be a school counsellor, there'll be a GP. We bring everybody into the room and say, okay, what does this look like on a local level? And our role in the Health Pathways program team is to make all of that happen, basically, and map the services, the endpoints, that if a GP, a clinician needs to make a referral, what services are available across our district. And the technical writers, they're the people that help us put it all together, put it onto the platform that you see that is literally Health Pathways, the site itself. So that's a very quick overview of what sits behind the program. The other final piece on this slide that I want you to know about is the send feedback, which is in underneath where it says each page on the site contains a send feedback icon. So what that means is that, if you're doing a search, I want to find Tamworth Podiatry, I want to update my details, you can do a search and then you can simply send feedback in Health Pathways itself, chuck in your details, and that will come through to us, and then we can update the relevant details on the site. And you can also provide feedback on clinical content as well. So if you could go to the next slide, please, Erica. So as you can imagine, when we develop pathways, we have over 300 clinical pathways in the Hunter New England region, for example, that a lot of work is involved in building relationships, having meetings, pulling together the subject matter experts, and getting agreement on what does this look like from a local perspective. And a lot of it is change management, and also about looking at, okay, this is what's happening, what can be done differently, and because we partner with Hunter New England Health, it gives us the ability to look at the whole landscape. And when we map services, we map public and private wherever we possibly can, and that's something that from a Hunter New England and Central Coast perspective, we pride ourselves on. Not all communities around Australia have the capacity to do that, but it is something that we spend a lot of time trying to do, is mapping our referral endpoints as best as we can to include private and public services. And our ultimate goal is to improve the quality and appropriateness of referrals and the efficient use of the health professionals, and improving the patient outcome, so their experience. With regards to Health Pathways. Can you just go to the next slide, please, Erica? So I'm going to show you just briefly. It's only one slide, but what we will do is we will, as we progress and towards the end of this, we'll probably jump onto the one of our live sites and actually show you. But what you're looking at on the slide at the moment is a clinical pathway. So this is the bread and butter of HealthPathways itself. So we have the clinical pathways, and then we have resource pages and referral pages that support the clinical pathway. So in this particular instance, the clinical pathway is social isolation and loneliness. You might have others that are newly diagnosed type 2 diabetes, it might be heart failure. So all of those are clinical pathways. Within each clinical pathway, you have the assessment, management, and the referral. So this is, for the treating clinician, it might be the GP. What's the standard process for assessment? Management, what can they do from a local community perspective? And then the referral endpoints. So you can see with this one, and you may not be able to see on your screens, but I can read a couple of them out for you. So the pathway, social isolation and loneliness, and the referral endpoints that we've identified with this particular pathway. The first one is specific social isolation resources. But then you've also got other related content. So it might be perinatal support, might be parenting support, mental health, family and carer support, drug and alcohol, domestic and family abuse and violence. So these are all referral pages that have referral endpoints to support the clinical pathways. And those referral pages is where your information as providers resides. So I just wanted to give you that context, and I'll briefly, from a final point before I hand back to Erica, when we write these pathways, they're clinically supported by, from a diabetes perspective, for example, if you're a dietitian, we have clinical resources that support the development of the pathway. So it might be, RACGP, general practice management of type 2 diabetes, for example. We have guidelines for management of type 2 diabetes from Diabetes Australia. So we link to all of these dedicated and clinical resources to support the development of these pages. So I'm going to hand back to Erica, and she's going to walk us through what a referral page looks like.
Thanks, Evan. So yeah, we just wanted to also give you some information on all of the referral type information that's in both HNE and Central Coast Health Pathways. So in both regions, we've got allied health sections. So on Central Coast, it's called Allied Health and Nursing, and I think on HNE, it's just called Allied Health. And then within those, we have the localised referral pages for the allied health and nursing services, both private and public. So you can see there, that's a huge array of information. We also have non-government organisation information and charities, social support. So whatever the topic relates to, we try to find the local options that are available for patients and clients, so that general practice teams can navigate their clients to the right services. So that's one section where there's lots of referral pages. And then another section, which is in both websites again, is the service directories section. So you can find that either through the search function or in the table of contents on the left. It's down near the end in the service directories drop down. And then that page links through to big sections. So for example, links back to the allied health section or links to the specialists page, which then has a summary of all the specialist referral pages that are linked to as well. So they're just quick kind of one-stop shop pages that then link you to a whole lot of other referral pages. So this might be useful if you're wanting to cross-refer your client to a colleague, another allied health professional, for example. So yeah, we wanted to point those out for you. All right, and then this is what a referral page looks like. And so as Evan said before, across all Health Pathways sites across the whole Health Pathways community, the sites look very, very similar. So they're the same architecture. The table of contents will be very similar, if not identical, but then there might be slight differences. Obviously, referral pages might be slightly different within regions, but in general, trying to find the information that you need is designed to be really quick and easy. The search function is really quick, and hopefully you'll be able to find what you need within a really quick time frame in a consultation. So within, seconds to less than a minute, hopefully we want you to be able to find what you need. And so this is an example of what a referral page looks like. In the Central Coast, we separate them there by private and public. And then in H&E, because it's such a large geographical area, generally their pages are set up in sub-regions of geographies. So there'll be a sort of a Newcastle sort of section. There might be the Port Stephens and then the New England Northwest, for example. And then within those, there might be subheadings depending on the page. So if there's multiple types of providers on one page, for example, with this one, Child and Youth Psychology and Counselling, in Central Coast, we list psychologists, mental health accredited social workers, and mental health accredited occupational therapists. Then we also list multidisciplinary child, adolescent, and family therapy centres, so the actual clinics. We also link to external directories as well. So as you can imagine, there's hundreds of providers. So it is a challenge for us to keep the provider information up to date. And for example, if a new provider moves into the region, we might not have captured them, as quickly as we would have liked. We need to become aware of which providers have started a new practice in our area, for example. So we also include those online directories to the professional bodies, so that if you can't find one in the drop downs on our pages, you can go to those directories and hopefully you'll find the provider that you're looking for if you're looking for someone specific. And then you've got the public services documented as well. And so on the next slide, I'll just go into a little bit more detail. So once you click the drop down in contact the provider, this is what Evan was talking about, the Health Pathways directory format. And then you can click on each drop down of the actual service, and I'll go to the next slide so you can see what that looks like. So this is an example where I've dropped down one of the providers, a psychology practice in Erina. And then this information looks the same across all Health Pathways sites. So it's designed to be really easily and quickly scanned through for you and find exactly what you need. So we've got the service there and then the actual individual provider. We've got their subspecialties and special interests, which is really helpful information. And then also if there's extra information for the referrer, such as what funding schemes they can bill under, or if they're a surgeon, for example, which hospitals they operate at, if they're a specialist, which hospitals they have admitting rights to, and so on. So there can be really detailed information that we capture. And we're always welcoming feedback as well. So you can see the little send feedback button in the bottom right that you can use if there's anything that you find a broken link or something that needs to be updated, or your service information needs to be updated. Just send feedback. It's like a little email that pops up, and then you just send a message to us that comes through to the program team, and then we'll work on getting that updated. All right, and then as Evan said before as well, you can also use the search function in various ways. So you can use it in searching for the clinical term that you're looking for a clinical pathway, or you can actually search for a service or your own service if you want to. So we've just given an example there of Lifeline. You can pop that into the search function, and that then brings up the list of pages that Lifeline is listed on. And then if you wanted to, you can then click onto the relevant pages. If your service is listed on multiple pages, you can then see what's listed. Generally, we will list the same information on multiple pages. So if you wanted to send feedback on what needs to be updated on your service, you can just send the one feedback and then we'll update it on all the pages that it appears on. And yeah, there's just some specific instructions there if you wanted to use the search and then expand all. There's a pop-out box at the top right. If you click on that pop-out, the whole right section toolbar will pop out. Then you can click on the expand all button. Then you can click back onto the page. If you use your keyboard, do Control F, a search box will appear. Then you can type your service into the search box, press enter, and that'll highlight on the page everywhere that your service appears, for example. And then you can actually copy that content from the page into an email or into the send feedback or into a Word document. And then you can actually make edits and copy that into the send feedback to us and send us the changes that might need to be made. All right, and then there's just one more example here. So as I said before, Lifeline appears on multiple different pages. One example is the suicide risk referral page. So then once you've popped out the toolbar on the right, there's the expand all button. That'll expand the whole page. So the whole page will be open up and then you can press Control F on your keyboard, click Lifeline, press enter, and then that will skip straight to that service on the page. And then, as I said, you can use the send feedback button. You can copy that text if edits needed to be made, paste that into the send feedback, and then send us what needs to change. All right, I'll hand back to Evan now.
Just before we have a look at the utilisation statistics, because you'll no doubt find it quite interesting. I just wanted to briefly mention with regards to the referral pages. So with our Health Pathways site, you can't break anything. So by all means, you're free to look at other pathways. You're free to look at the referral options under the different regions. So in the Hunter New England, for example, like Erica mentioned, we list ours because we cover everything from sort of Newcastle, Lower Hunter, Upper Hunter, New England, Northwest, you know, from Newcastle out to Mungandai and up to Tenterfield. We've tried to break that up into geographical regions, and you'll see that, you know, if you go onto the physiotherapy referrals page, for example, you'll see that we've got, you know, 5 or 6 geographical regions listed under there with public and privates. Generally speaking, just for your benefit as a provider, if you're a private provider, generally with private services, we typically just list the service. So we're really just after, you know, what's the name of your service, what's your subspecialty or your focus areas, and what's your address and what's your contact details. With the public services, we do sometimes go into a bit more detail with those, particularly just around referral criteria, urgency information, things like that. But generally speaking, from a private perspective, you don't need to worry about that. The other thing you might find on some of our pages is, and our psychology and counselling one's probably a good example of that. We do also list things like out of area, for example. And, you know, sometimes that might involve, you know, patient flows to particular towns, for example. But we also list telehealth. We have a telepsychology services section identified on that particular page. And we also list statewide as well. So, you know, services that are applicable to the entire state or the entire nation as a whole. So we try and separate those out as well. And just in case anyone listening is potentially on the border of a PHN boundary, for example. So to give you an example, if you're maybe in Tenterfield, or, you know, if you're in the Taree region, or you're north of Taree, the other communities that are close to us, so the likes of Port Macquarie and Gundawindi, those communities also utilise health pathways. And what that means is that you can potentially contact those PHNs, and if you have any difficulties, please reach out to us and we'd be happy to assist you. And what that means is that you can advertise your service on their health pathway sites as well, potentially. And it means that you can be visible if you're seeing patients from those areas. And it also means that GPs in those areas can become aware of services that people might need to travel further afield. So particularly if you're in Tenterfield, for example, you know, your services often are down on the coast. It might be Coffs Harbour, for example, or things like that. So yeah, we can potentially help out as best we can in those situations as well. Now, from a statistics point of view, Hunter New England has been in operation for 13 years, and I think Central Coast, Erica, when did it?
Just 1 year younger, so yeah, 12 years.
Yep. The footprint. So bear in mind that the footprints are different from a geographical size and also a population perspective. Obviously, the Central Coast is quite dense. So with what you're looking at at the moment on this slide is monthly usage from a user's perspective, so end users, and H&Es at the top, Central Coast at the bottom. So H&Es sort of fluctuating around 3,500 users per month, with Central Coast at around 500 to 600, and that is usually representative of the number of, first and foremost, general practitioners, but then secondly also it might be practice nurses, for example, allied health professionals, and other people supporting either the development of the page. It might be staff within the LHD, anybody accessing community health pathways, and we track that. There is also a hospital health pathways, I won't go into the detail, but there's also a hospital health pathways that's been implemented, and it is designed to facilitate what does clinical conditions look like in the hospital setting before patients are discharged back into the community. And the information, if any of you are aware of the e-referral platform that has phased out faxing, for example, this applies to anybody in the Hunter New England region. The electronic referral is actually based on health pathways. So for the public services, that's why we have that criteria and urgency, because we utilize that in the electronic referral service. Private providers can opt in to e-referral, but generally we don't, as I mentioned earlier, we don't have that specific service criteria information, but you can utilize the e-referral platform if you wish. And then the next slide is looking at page views. So we're up around this 60, 75,000 page views per month, and about 12,000 for Central Coast. So quite a very active user base across our footprint, which is fantastic. And we've really spent, I guess, the last sort of 10 years trying to build that support and build that audience to utilize health pathways. And you know, people that might move to a new town, they love it because it gives them access to you know, what services are available, where can I send my patients, that kind of thing. So and I think, sorry, I'm just looking at, so with patient info, we're just going to switch gears briefly. So everything that you've seen up until now tonight is for the health professional. But what we do is when we develop clinical pathways, because we have everybody in the room, we say, okay, what does this look like from a patient perspective? You know, this was all to help you, which is great, but what resources are available to help the patient? So what are you giving to them? You know, what are you printing off for them? What brochures, handouts, etc. And what we try to do is we try and attach those to the pathway, and we share them in a for patient section at the bottom of each clinical pathway. And then what we do is we publish that information to a patient information website, and that's what you're seeing on the screen now. We have one for Central Coast and we have one for Hunter New England, and that's because the content might vary slightly. Again, the purpose of the program is to localize this information as much as possible and make it relevant to the community that needs it. The purpose ultimately of the patient info is Dr. Google, and just to try and support patient awareness and patient education. And we have little business card type items that we give to practices to say, you know, jot down on a pen on the back of this, give it to the patient, say, I want you to go home and look up, you know, resources about COVID, or it might be after hours medical care, it might be mental health, for example. So on the slide at the moment, you can actually see, and if we go to the next slide, we actually have, so we have a mental health, emotional and social support, for example. So what services are available and what resources and information are available to the patient that is locally relevant to them. So sometimes, you know, when I put together the drought support services page, we almost did a direct translation of the pathway and the support services from HealthPathways to the patient info site, because a lot of them were self-referral. And the e-mental health online resources, which is the slide on the right, it's actually a fantastic page that, you know, the GP said, okay, you know, we're going to refer you to a psychologist. Obviously, there might be a wait time associated with that. The e-mental health online resources are things that the patient can go home and do today, and we've mapped all of the e-health online resources, and then we've categorized them into things like grief and loss, addiction, anxiety, depression. And they're all links to often peak bodies that have these programs. There might be just a short, you know, 45 minutes, for example, that the patient can begin to get engaged and to begin to get a bit of an awareness about, you know, what they're experiencing. So that's patient info in a nutshell. Directly, I just wanted to make you aware of that. From a service endpoint perspective, a lot of the information that you probably provide to us, particularly about the service itself, will go into HealthPathways. Some of it may occasionally come across into patient info, but I just wanted to make you aware that that is attached to our program. So if you do see it, that's what it's about. Sorry, Erica.
Yeah, but I might just add as well here that, and all of the information on patient info has also been curated and reviewed and checked over by our clinical editors and our subject matter experts. So that's where we can sort of confidently say to our general practices that they can recommend this site to their patients because it's been checked over and it's appropriate, reputable, evidence-based information that's been collated. And as Evan said, often we're actually linking to educational resources from peak bodies or non-government organisations that have been funded to do patient education as well. And then, yeah, we might have some phone numbers for phone helplines or, as Evan was saying, online cognitive behaviour therapy programs. So it's all been checked and curated by our teams, our clinical experts that we work with.
And it's a fact-based site, so we don't we do our utmost. We don't, that I'm aware of, we don't have any advertising, for example. And part of my role is actually from a health literacy perspective to check resources to make sure, you know, plain and simple, that they're readable and understandable. So we prefer, you know, easy to understand terminology. And if that's not available, we go looking for it, or we try and create that information if necessary. So I'll hand back to Erica.
Thanks, Evan. Okay, so now we're sort of onto the practical side of how you can actually become involved in Health Pathways. And we really, really welcome more involvement from allied health professionals in the Health Pathways programs. So as we've talked about before, we'd love you to send feedback if you find something that you think needs to be added, updated, a broken link, a phone number update of your referral information. All of that type of information can be sent through the send feedback button. So just on each page, when it comes through to us, it actually shows us exactly which page you've sent the feedback from, so that we know where to update that information. So yeah, we welcome updates to referral information, as always, into the future as well. And then you can also express interest to our teams through the send feedback, or just contacting our teams by email or phone, or through the PHN phone number, in being a subject matter expert. So as Evan said, when we actually work with groups of clinicians in primary care and secondary and tertiary care, we want wide kind of professional input from multidisciplinary teams. So we would love you to volunteer to be a subject matter expert for working groups that we work on, either updating existing pathways or developing new pathways. And so you can actually come to an online working group meeting with like-minded professionals to work on a big piece of work. For example, both teams have recently been doing updates to our older people's health sections. So we're actually updating all of the pathways within that whole section. So that can be 10 to 15 pathways, for example. Or you can just express interest on working on 1 or 2 pathways that we gradually updating. So we have review cycles. So generally most pathways are reviewed every 3 years, have a full review. And then in between the 3 years, we do smaller partial updates. And so when we do a full review, or we're localizing a new pathway, we want subject matter experts. So from allied health, nursing, general practice, specialists, surgeons, non-government organisations. So we would welcome you to express interest. So just contact us. We've got some contact details on the next couple of slides, and let us know if you're interested in what topics or what special interests you have, and then we'll record that in our systems, and then we'll contact you when we go to work on that topic. Okay, so these are the last couple of slides. So this is how to contact the Central Coast team. So the email address is there in the bottom left, and then on each site as well, you can just search for contact us in the search function, or in the left table of contents in the About Health Pathways section. Then there's a contact us page, and then on that page you can find the general team email address. And then also up the top right of every page are those 3 little dots in the vertical direction, and that's a little pop-out field as well. And there's a contact us quick link there too that goes to that page. And then HNE is the same concept, same page, and then the local contact details are down the bottom of that page. So that takes us to the end of our slideshow. I might just pop over and actually do some demonstrations, and then Evan and I can talk through the sites. And then if we have any questions, Sandy will probably chime in and ask those, and we can answer those questions. So I'll just open both the sites.
So I might just chime in at the moment. We don't have any questions yet, guys. So if you do want to send your questions through, please do that. And then I can share those with Evan and Erica.
Great, thank you. And I'll just open up the Hunter New England patient info as well. All right, so yeah, this is a live demonstration of the sites. So we've got Central Coast here. I'll just make that a bit smaller so you can see a bit more of the screen. So this is the Central Coast Health Pathways homepage, and then I'll pop over to HNE. So this is the HNE homepage. And as you can see, they're structurally very, very similar. And then it'll just be the content that's slightly different. And then in patient info, this is the patient info Central Coast homepage. And then again, the HNE patient info page. And you don't need to remember the websites for patient info because they're actually on the homepage in this right section. Patient info here for HNE, and then the same just a bit further down for Central Coast. So if you're wanting to provide your patient the website, you can just click onto the Health Pathways homepage and click through to the patient info sites. Evan, is there anything in particular that you think we should demonstrate? Maybe the pathway updates section would be a good one to start with.
Yeah, maybe have a look at that, and then from a Hunter New England perspective, I might just show a couple of pages.
Yeah.
Sorry guys, I might chime in because we've got a question.
Yep.
Kira is asking, as a private provider, do you need to be working with e-referrals to receive referrals via Health Pathways? So Evan, that would be
No, you don't. It's a good question. Thank you. Short answer is no. No, you don't. So the e-referral primarily was designed in the first instance to support the public service with optional opt-in for private. We have got quite a good uptake, but all I would say to you is just look at how you're currently receiving referrals. And for a lot of our private providers, we might just list a phone and fax number, for example. You can see on the screen there, that one's actually got email. Some businesses are actually just putting the referral option as an email. We prefer not to do that because email in and of itself is not actually a secure platform. So if patient details are actually sent via email, that email can be intercepted and you end up with a privacy issue, which can be quite an issue, you know, from a police perspective or anything like that. So we try and avoid that. And then, yeah, phone, fax, and we have an e-referral option as well, where some private providers have opted in, and then the e-referral button gets ticked, and then the GP can actually either, you know, via best practice medical director, things like that, can actually go into their clinical software and send the referral electronically. So that's the long answer, but the short answer to your question is no, you don't need to be utilizing e-referral in order to have your information put into Health Pathways if you're a private provider.
And I might just add there as well that, yeah, so similarly with Central Coast, we do list emails and then we put in brackets after it non-secure, but we also list secure messaging as well. So if you as an allied health professional have HealthLink or Argus or any of the other secure messaging softwares, we've got a separate field that we can insert there and put your secure messaging information there so that the GP can then look you up in the address book within that secure messaging software. And as Evan said, we're moving more and more, all regions are moving more and more to e-referral systems, and Health Pathways is a way to enable that. So yeah, we would encourage you to use secure messaging as it's encrypted and it can't be, I guess, hacked into by malicious people who are seeking sensitive patient information. So yeah, we would encourage everyone to move to secure messaging, and we have a digital health team at the PHN as well who can assist you with that, and we've got lots of resources on both Health Pathways and our PHN website on how you can move towards more taking up of digital health and secure messaging. So yeah, as Evan said, that's fine if you don't use sent e-referral, and the Central Coast hasn't got sent e-referral yet, but we can still list you as a provider on the referral pages.
I might just quickly show just 2 pages
yeah.
just to highlight a distinction. Can you just have on the table of contents on the left-hand side, just under allied health referrals, can you just expand that for me, please? And then if you go to dietitians referrals, the top one, for example.
Yep.
Now, if you open, just expand the Manning region, for example. And if you expand private, now here you'll notice, so first and foremost, if anybody is in the Manning region and you say, okay, yep, that's my service, or a service isn't listed, great, that's where you can send feedback. But when you have a look at this list, you'll notice that the list is service based. Now, what that means is that you can see that they're all business names, they're not people. Sometimes we put the practitioner underneath. It really just depends on the page as to how much detail we're going to go into. With our psychology and counselling page, for example, it's easier for us to put the service because the service might have 5 psychologists, for example. So from an information collation perspective, it's easier to do that. But you'll notice under that dietitians page that the private, under that section, under the private, it just lists the contact details. So you can see the address, there might be information for referrer, you know, this particular instance, face-to-face consultations in Foster, online telehealth also available, and we link to a website. And a lot of private providers do have their own websites. If you condense the private section, Erica, and have a look at the public, you can start to see that it looks slightly different, where we have criteria, and in some instances we might have a referral form and we might have urgency as well. So for their priority allied health service, for example, or we might have commissioned services through the PHN, we might list additional information. If we quickly flip over to our lymphedema page, and you can either just do a search for lymphedema, and it's the lymphedema management services. With this one, if you just open up the New England Northwest, for example, and it's the private, what we've done here is they're actually individuals, so it's people, and you can see the subspecialty that we've put in for that. So if you are looking at the page and you, I just wanted to highlight that distinction, that you may sometimes see, you know, it's just listing the service or it's listing the person. There's a reason why we do that, but don't let that prevent you from you know, sending us your details. So.
And as everyone was saying, with public, often we'll have quite a bit more detail in both our sites. We'll have more information in the public sections, particularly because there might be long waiting lists, there might be criteria, there might be specific information that they need in order to triage the referral, so that all of that information is provided in quite lengthy detail, so that the referring doctor, for example, knows all of the information that they need to provide in the referral, so that patient gets triaged appropriately and navigated through the health system. Yeah, that's great. Thanks very much for that, Evan. And then I'll just give you some updates about something that is probably really useful for you as a clinician to find what's changed recently on each website. So on the homepage of each website, excuse me, we've got the pathway updates section, and that has the most recently published pages. So either they're newly localized, so that's marked in the little green, and the new, so that's a page that wasn't previously localized for Central Coast, and that's just been localized and published. Or it'll say updated. So updated could be either has had a full review at the 3 yearly stage and the whole page has been reviewed and updated, or it's had a small partial update in between the full review 3-year period. So those are the most recent changes. And then down the bottom, you can click on view more updates. And this goes to the daily updates page, which has a quick summary of the change that's been made. And so all Health Pathways regions have this, and part of our team's role is to summarise what we've changed, either when we've localised or when we've done reviews or partial updates. So as we said before, Health Pathways is a community, and we all share across our regions to increase efficiency and share knowledge and resources. So for example, the tongue tie clinical pathway, our team recently localised that. We used another region in Australia's pathway and just adapted it for the local region. So because a lot of the clinical information in assessment and management is common across Australia and even New Zealand, we can use other regions' pages that have already been localised by them, reviewed by their clinical editors and their subject matter experts, and then we just do small changes to localise, make sure the management and the referral information is local to our area and aligns with the subject matter experts and how they manage that condition in the local area. So we will just see here a brief summary of what has changed when we localise that page. And then similarly, when we do a full review, we'll explain what's changed. And so you can keep visiting this page on a regular basis every week or two and see what's changed, and you might find some more information. For example, when we updated social prescribing support, we added some new sections in and a whole lot of new employment providers. So you'll see what's changed since you last looked at that page, and that's really helpful. And Evan, I might just quickly in our couple of minutes that we have left, just so show the difference between a localised page and a non-localised page. So I might just pop back. Here we go. So when you expand the table of contents, for example, you'll see the difference in colour. So a black page in the table of contents where the title is black means that it's been localised, and it'll have the white background, and that's been localised for the Hunter New England community. Whereas if you see that it's sort of a greyed out title like this, that means that page hasn't yet been localised for the Hunter New England region. It appears as a yellow page. It's got this warning up the top, which it hasn't yet been adapted to the local region. And then both in Hunter New England and in Central Coast, non-localised pages will be the Canterbury, New Zealand pages. So when we licensed Health Pathways, the concept, we get the whole of the Canterbury suite of pages, and then we gradually work through localising those. So that's where you'll find the difference between a localised page and a non-localised page. The assessment and management information on a non-localised page might still be useful for you as a clinician, because the management and assessment generally in Australia and New Zealand are very similar based on the clinical guidelines, but obviously the referral section won't have anything relevant for you. So that's just the difference between a non-localised and a localised page. I think we've only got a couple of minutes left. So Evan, was there anything else specific that you wanted to show?
No, I think that's it actually.
If people are looking for any more information, there's always this About Health Pathways section, and this little section in here called How to Use Health Pathways as well. And if you'd like us to come to your practice and do more of a demonstration or train your other colleagues, we are always happy to do practice visits as well. So just contact our teams and we'll endeavour to come out and visit your practice as well. All right, so I might hand back to Sandy now, because I think we're almost out of time.
Absolutely, perfect. We've got 2 minutes. Thank you so much to both Evan and Erica for that amazing presentation, very comprehensive. I would really encourage you, you as attendees, to just go into the Health Pathways sites and have a look at them. You really can't break it, but the level of information in there is fantastic. Erica, I don't know if you just want to, in this time, put the slides back up for the login details. That would be awesome, just in case you missed those, because that's really important. And it remains for me to remind you, please, to do the evaluations. They are really important to us. And thank you all very much for attending and with us tonight, and that these slides and the recording will be available on the Education Library on the PHN website. So thank you very much.
Thanks, Sandy.
Thanks, guys.